Pain is a very common problem, but a lot of people who have it don't know the cause or how to get rid of it. Here to talk about that lower back pain is orthopedic physical therapist with Hartford Healthcare's Rehabilitation Network, Jake Smith. Thanks for being with us today, Jake.
Thank you, Darren.
All right, what typically causes lower back pain?
Yeah, so we're getting away from considering just a single factor as something that can cause low back pain, and considering that it can really be a multitude of different factors kind of converging together to create an experience of low back pain. So this includes things like life stressors, poor nutrition, poor sleep habits, maybe even trauma. And then a big thing is performing a task that your body isn't necessarily prepared for. You can kind of break this up into three buckets, looking at things that are biological, so the things that are kind of to do with the body itself, and that things that are more psychosocial, so things like life stressors and stuff like that. The thing that tends to be a little bit less important is stuff like lifting technique, posture, and findings on imaging, because they tend to be a little bit less correlated with the pain experience. But everybody should know that low back pain is very common. Maybe the greatest risk factor is just being a human, as there's a lifetime prevalence of 84%.
Yeah, we've all had it. So the big question is, how do you know if it's just, boy, I tweaked my back, or if it's something more serious?
Yeah, so if the low back pain is accompanied by a sudden onset with a big loss of strength, some progressive weakness in the legs, and especially a new onset of numbness, especially in the groin, this can be pretty worrisome. But this condition tends to be a bit more rare, and it tends to be correlated with changes in bowel and bladder function. But people should know that only about 1 in 65,000% of people get this particular condition, and it only happens in about 1% of disc herniation. So bad problems from back pain tend to be a bit more rare. Also, if they're correlated with things like fever, malaise, or other systemic signs that aren't necessarily musculoskeletal, that tends to be a bit more concerning. But most back pain is not serious.
Okay, so if it's not serious and you roll out of bed one day and boy, it's getting you, what are some things you can do? What are ways you can relieve that lower back pain?
Yes, so some of the best advice that we can give people, and it comes highly recommended from the people who make our clinical practice guidelines, recommend to stay as active as possible with these people. The last thing that kind of feels like that you want to do after this happens is move, but it tends to be the thing that's probably going to help you the most. So if your activity before was walking, and it's kind of hard to walk right now, you might try doing a recumbent bike. Or if sitting tends to hurt a lot worse, you might try an activity like walking. So aerobic activity, staying as active as possible, tends to help you move that needle forward to coming back to your goals as quickly as possible.
Okay, and if your back pain is persistent, what can you do to treat it or manage it in the long run?
Yeah, so things like imaging tend to not necessarily be recommended right away in the absence of a lot of those signs that I talked about earlier. But definitely getting checked out by a physical therapist tends to be obviously something that I would recommend. And a physical therapist that tends to recommend more of an active approach tends to be a lot more helpful for these people. So we're definitely able to kind of rule out some of those sinister and serious low back problems that I talked about before, and develop a plan looking at your aggravating and alleviating factors to try to get you to return to your prior level of function as soon as possible.
And if you haven't been to a physical therapist, boy, you folks know how to work the body, and I personally have had good luck with it. So good advice to go see somebody like you.
Excellent.
All right. Jake, listen, Jake Smith, orthopedic physical therapist with the Hartford Healthcare Rehab Network. Appreciate your time today. Thanks for being with us.
Thank you, Jeff.